A controversial Airbnb-like scheme that sees homeowners receive up to £1,000 a month to rent their rooms to hospital patients could be rolled out in Cambridgeshire. Dubbed CareBnB, described as Airbnb for social care, the private startup care rooms for those recuperating after treatment is bidding to launch a new trial in the county. This comes after it was forced to terminate its first pilot with the NHS in Essex last November, despite receiving around 600 applications in 3 days, after concerns were raised about care being provided by non-professionals. Care rooms was devised as a radical way to free up hospital space, as bed blocking rates remain high while the NHS battles a heavy winter. Despite facing an avalanche of criticism, Care Rooms is establishing a working group with Cambridgeshire County Council and has begun advertising for host households in the county. The Conservative-controlled council confirmed the group would meet for the first time imminently to discuss the innovative Care Rooms concept, but adds it is not committed to the pilot yet. What does Care Rooms hope to offer? The plans do not require homeowners to have any prior care experience before housing their guest, but offer them the opportunity to seek such training if they wish to. The scheme, believed to be the first of its kind in the UK, claims to create a safe, comfortable place for people to recuperate from hospital. As well as alleviating chronic bed shortages, it alleges to stop delayed transfers of care, which are behind the worst bed blocking rates ever recorded by the NHS. Chairwoman of the Council's Adults Committee Anna Bailey told HSJ, "The Council has not committed to piloting care rooms, but we think the innovative concept is interesting and worth exploring." "We would like to give Care Rooms the space to explore its concept and help the company gain a deep understanding of the system through access to staff within it." Ms. Bailey added the makeup of the working group is still being confirmed, but would include senior adult social care council officers, council commissioners, and some frontline social care and NHS representation, possibly a nurse or community matron. Who is funding the plans, and which patients are eligible? The plans are thought to be funded by the NHS and local councils. However, patients may be able to pay Care Rooms directly in the future. Each room would cost around £100 a night, with half going to the host. Care Rooms would pocket the rest once care services have been paid. Patients who have had a minor procedure and live alone would be eligible to be sent to such private homes, as well as those whose families are unable to provide sufficient care. A company spokeswoman previously agreed the model is comparable to Airbnb, the website that allows people to rent out their spare rooms in properties. Mr. Godin co-founded the New York Bagel Company in the 1980s, but has spent the past 25 years in the healthcare field. He claimed to have the idea for Care Rooms while looking after his father, who died in 2016 following a long battle with Parkinson's disease. Mr. Godin said his father was frequently in hospital, with discharges being challenging due to the specialist equipment he required. He believes care rooms addresses the increasing shortage of care homes and NHS capacity, while providing households with an additional income and patients with social interaction. Mr. Godden said his mother became socially isolated after his father's death and would have benefited from renting out a room in her house, which was well equipped with medical devices. How serious is the NHS bed blocking crisis? The scale of bed blocking in the NHS is the worst it has ever been, with nearly 4,500 people trapped in hospital at any given time. The problem has more than doubled in the past 7 years, from 55,332 beds that were blocked for a whole day in August 2010 to 118,131 in July 2017. Experts claim the numbers are being driven by a social care crisis, with patients who could leave hospital being stuck due to no suitable nursing accommodation being available for them in their communities. Up to 8,000 people die every year due to bed blocking on NHS wards, researchers said in October 2017. The toll is the result of so-called delayed discharges, in which there are no beds for those who need surgery due to patients who have been treated and are medically fit to go home being unable to leave hospital. Using NHS figures from August 2010 to March 2016, the scientists found that, when delayed discharges rose sharply between 2014 and 2015, the number of deaths in the wider population soared as well. Amid its criticism, Care Room's chief executive Paul Godden defended the concept, stressing the program offers greater choice to patients who are fit for discharge. Although hosts could earn up to £1,000 a month by taking part, he added they would not perform care, but patients would instead be monitored 24/7 via technology that assesses their function. Patients would also have constant access to a video GP service. Hosts would also be required to go through a vetting and training process, Mr. Godden added. When asked about the lack of Care Quality Commission (CQC) involvement, Mr. Godden said, "We are providing safeguarded rooms and a meal service. We are contracting CQC-regulated third parties to provide the care, if it is required."